The centration of joints means that once there's a disturbance in the muscle balance, there's an automatic change in range of motion availability.
Okay. I guess, yeah, let's just start there. If you were talking with a chiropractor who had never done any work, or a healthcare practitioner, never done any physical medicine stuff involving movement and rehab, and now you start talking about things like ideal movement or functional joint centration, how are you going to describe that? What are you going to talk about?
Well, the idea of ideal movement is somewhat controversial. We speak about it as if there's only one way to do something. And in actuality, ideal movement is a concept of quality rather than of observational execution. Meaning, if I see somebody doing something, the criteria by which I determine if it's as ideal or not is, first of all, the ease, the sense of ease by which it is performed or executed. And then what the components are, and what is the final outcome for the person involved, meaning, did it damage, did it enhance, or left them unaltered in potential? So if someone performs a movement that is painless, that is seems easy, and is effective, and it is efficient, then I would assume that movement is ideal. I cannot determine it by observation alone, but I can compare it, one, to the natural movement of the child, which we assume is unadulterated and as close to effortless as we can get. And I can also assess the resultant effect on the musculoskeletal system.
I think that is the most important part of that definition, or at least that's the point that we tend to, in one sense, you and I tend to stress, I think, but maybe it doesn't come across in most, number one, in most any type of physical medicine seminar where they're talking about ideal postures or movements. They're not talking about, well, the only really way to know is if you assess them afterwards. They're primarily concerned about the observation of the biomechanics.
That's right.
And like you mentioned too, I mean, the output of pain. Obviously, if something was painful to do, they'll consider it obvious that you weren't using an ideal movement. But if something's painless and it looked good according to biomechanics, that's about as deep as anyone typically goes.
That's right. But that is insufficient because it tells you nothing about the actual status and a change in status before and after. So it's really important that we have a way of auditing, collecting data before and after, and seeing if over time the repertoire of movements that are performed are damaging, not damaging, or enhancing to the person who performs these movements. And by assessing that, we can come to a decision about the efficiency of this movement, the safety of this movement, and whether we should recommend it or warn the person to desist or decrease the amount of reps or the the volume or intensity of performing this movement over time.
Yeah, I guess, and I mean, of course, we're DNS instructors, so our assumption or our bias is that we can reliably use the developmental model as somewhat of an objective framework to give us a pretty good idea of whether or not this person looks to be using the right pattern, and uses a frame that framework can be used as guidance for the right pattern. But ultimately, like you said, I mean, I can't 100% for certain tell if somebody's using the correct pattern or an ideal pattern based on a photograph or based on a video.
That's right. That's right.
I can get a good idea.
That's right.
I can make a good educated guess, but it's still ultimately a guess. And now, I mean, you're talking about you need some type of audit, some type of assessment before and after. Just for our sake, I mean, what kind of things are you looking at before and after that will tell us whether or not somebody did, in fact, use an ideal pattern or an ideal posture?
Well, we have many physiological processes that respond to movement and whether it is efficient or not. However, from the clinical point of view, the easiest parameters that we can measure are: did the person maintain, improve, or decrease their range of motion, either passive or active? So, did the range of motion change? Was there a change in the ability to produce a force? Which means, is the testing of strength, is there adequate production of force in time of need? And then
now, when you talk about range of motion, did it increase, or at minimum, I would imagine, did it stay the same?
Yes.
What specific range of motion are you looking at? Are you looking at lumbar spine range of motion? I mean,
it could be lumbar spine range of motion, but it's probably better to look at the extremities, because the extremities have a larger range of motion in terms of angular range, and so changes in that are more easily detected. And you are dealing often with just the four primary spherical joints, which are the shoulder joint and hip joints. So that narrows down the joint interplay, but it gives you a chance to see in a 3D scope if there has been a loss of range of motion. So,
and we're talking. Sorry. We're ultimately saying that, regardless of a patient's complaint, or regardless of an athlete's intention, we would check the general range of motion of those spherical joints before and after, just to get a global picture of how this person's nervous system is functioning. Because we're assuming that, and it's a good assumption, I don't think it's controversial to say that the nervous system is ultimately controlling the ranges of motion insofar as there's no hard structural damage within the joint.
That's right. The centration of joints, which we ascribe to in DN, means that once there's a disturbance in the muscle balance, there's an automatic change in range of motion availability. And with that comes a change in muscle and the development of tenderness or nociceptive areas within the muscle system. So we have there empirical factors that we can monitor to tell us if the nervous system And the musculoskeletal system in tandem or in series are under duress from the movement choices that have been made by the person.
If you enjoyed this conversation and want to hear more like it, then please like this video and subscribe to our channel. You can also stay up to date on our latest seminars on our social media pages on Instagram and Facebook at IMTR Seminars.